Good afternoon, good evening, and good morning wherever you are, and welcome to the Ifso 31st Journal Club interview. Our Journal Club will be held on the 10th of February, so please mark your dates and join us at that day. I have the honor and the privilege to interview Dr. Antonio Vitiello from University of Naples. Welcome, Antonio.
Hi, Dr. Bashir. Thank you for this good introduction. I'm very honored and humbled to have been invited to join the Ifso Journal Club. It's really my pleasure to be here.
So thank you very much. And a very interesting paper that we are going to discuss. It's studying two aspects, which are long-term outcomes of sleep in your center, 10 years, and matching those patients to previous patients that you had who had gastric banding. So it's a very interesting concept. How did you come up with the decision to actually do that study?
Thank you very much for this question, because when I started my training, my surgical training, the gastric band was still a very common procedure in Italy and in Naples and in my hospital. But we were seeing all these patients coming back to the outpatient clinic, and they had regained the vast majority of the weight lost. Or also they were complaining with vomit, nausea, regurgitation. So the gastric band had to be removed, or they had to be converted to another operation. So that's the reason why it was abandoned. And in that period of time, the sleeve was starting to rise. Everyone was doing the sleeve. Even these days, everyone is doing sleeves. So we had at those time a lot of patients converted from gastric band to sleeve. But I don't know if this is happening elsewhere, but I'm sure, that this is happening also elsewhere. But in our hospital, a lot of patients who had the sleeve 7, 8, 9, 10 years ago are coming back, and they are complaining with the same problem. They have regained weight, they are complaining with gastroesophageal reflux. And so we are now converting a very high percentage of sleeve that had been performed more than 5 years ago. So that's the reason why I wanted to do this match. I wanted just to realize if in long term, maybe the restriction that we have with the sleeve is destined to fail as the restriction that we have with the gastric band, or at least I wanted to see if there is a high percentage of weight regain and unsatisfactory results with the sleeve in long terms. I'm not speaking in medium or short term, because we know that in that case the sleeve is very effective. I just wanted to see if after 7, 8 years the result was the same of the gastric band.
And were you surprised with the results when you matched patients?
This is another very good question, because I must say that I was not very surprised, but I was surprised. I mean, I was expecting that, because I want to stress this concept. This study came from our daily experience. Every day, our daily practice, every day we are seeing patients coming to clinic and complaining about the sleeve. They had the sleeve 3, 4 years ago, and they are not happy anymore with the results. But I was not expecting that that results were comparable at 10 years. And we will discuss this better, of course, on the Journal Club. They probably are not comparable in any case, but I was surprised of the fact that in our study the results were comparable, because I was expecting more from the sleeve.
So what is the message that you want to deliver to the audience so they can even tune in more on the 10th of February?
Well, the message, I hope it's clear, it will be clear. And the message is that we don't have just the sleeve. The sleeve is the most commonly performed procedure. 60% of worldwide procedure is a sleeve gastrectomy. That means that 1 out of 2 patients receives a sleeve gastrectomy, and this is not this is not good. Maybe this high percentage of patients regaining weight is due to the fact that we have done the sleeve too many times in too many patients. So the message is that after 5 years, we can have a serious weight regain with the sleeve. So we must take this into account when we decide what kind of procedure we want to do. We have to remember that we have the Roux-en-Y gastric bypass, the mini gastric bypass, we have the sleeve. In selected cases, we also have the band. So we should really, tailor the procedure on the patient and just not indicate a sleeve in half of the cases.
Let's see. Tune in to our journal club on the 10th of February with Dr. Antonio Vitiello, and Professor Musala will join us as well as one of the authors. Maybe it is the rebirth of gastric banding after all. We'll see.
Let's see.
Looking forward to talking to you again, Antonio, on the 10th.
I'm looking forward for the Journal Club. Thanks again for the invitation and for this introduction. Thank you very much.
Thank you.
Bye.